سلام دوستای گرامی، امید که همگی خوب باشین، سرحال باشین و یک رمضان خوش را سپری کرده باشین تا فعلا. امروز همراه ما یکی از دکتران موفق ترین دکترای شهر تورنتو همراه ما هستند، دکتر حسن پیوندی. And Dr. Paywandi, welcome to our live session today.
Okay, thank you.
How are you? How are you doing?
I'm doing good. How are you yourself?
I'm good. I'm good. So I just wanted to give a quick background about yourself, your practice, to all the viewers that are watching us through Facebook right now. But first and foremost, thank you so much for accepting our request to come live. You've always been one of CWB's most generous donors, supporter, and you've been with us since day one. I remember when we were launching CWB and you were sitting in the very first row. So thank you once again for supporting CWB.
Well, no, thank you so much for you inviting me today. And of course, I know you as well as Farid Jones from day one, and I support you guys, and I know you guys are very sincere and doing a great job in running these campaigns and these organizations, in supporting and helping individuals and families, children back home in Afghanistan. So thank you so much for your hard work and for your contribution to making Afghan community a better community and society.
Thank you so much, Dr. Paywandi. دوستای عزیز, Dr. Hassan Paywandi is a family physician that practices in Woodbridge, Ontario, and I believe you're the founder of Paywand Medical Clinic. It's a very well, it was launched just recently, about a few months ago, I believe. And you're Dr. Hassan Paywandi, yes. Okay, so Dr. Hassan, he's someone that had completed his education in UK. He started practicing in UK in 2015. Then he moved to Toronto and he got his accreditation in Toronto. And he's been a family physician in Toronto with dual accreditation to practice both in UK and in Toronto. Dr. Paywandi, the purpose of going live, or our live session for today, is to educate or raise more awareness about the COVID-19 or coronavirus. If you can briefly explain what coronavirus is or what COVID-19 is and what the symptoms are.
Okay, so just to make a correction, Nuria John, I relocated to Ontario in 2015, but I qualified in 2005. Okay.
Okay. My apologies.
No, it's all right. I just wanted to make correction, just your audience knows. Before I answer your questions, what I would like to say in this holy month of Ramadan, Ramadan Mubarak to everyone around the world, and to all of those who have joined us today. And I hope this month is going to be a very fruitful month for everyone. And donation from everyone will be forthright ease and willingness. But to answer your questions, what is coronavirus? Coronavirus is a virus. It's a new virus which belongs to a large group of viruses. They're abundantly found in animals. Unfortunately, some of these viruses are able to jump from animals to human and make human as a host. Roughly so far we know about 7 strains of this coronavirus which exist in human. 4 of them usually cause very mild cold symptoms and not causing any problem. The other 2, which we all know was causing problem in early 2000 and 2015, those were SARS and MERS or camel flu. COVID-19 is one of those new coronavirus, which obviously has got tendency for respiratory system. It affects cells which has a receptor called ACE2, and it affects basically the respiratory system and causes very severe respiratory infections. This virus is really more than 10 times more infectious and deadlier than flu vaccines, flu viruses. Um, Even though this virus is mainly, we say that it affects your respiratory system, but it does affect other parts of the body, such as brains as well as kidney. So we had cases like this. So far, as of today, 28th of April 2020, we know more than 3 million is infected all over the world. About 212,000 of them we had death. In Afghanistan, I think it's been around 2,000 cases with 60 deaths. In Canada,
that is the number of reported cases. So there could be some that are not reported, correct?
That's right. We'll come to later on the fact that the lack of funding and stuff like that makes more difficult to do the testing as well as reporting of these cases. But this is what we officially know. But infected cases may be much, much higher, as well as the death. In Canada, we've been having around 48,000 cases. 2,700 of them was reported death. In Ontario specifically, we had about 15,000 infected and 1,000 death.
Okay, and Dr. Arsab, if you can, what is the symptoms? So can you explain what the symptoms are and how are the symptoms different than a regular cold or flu?
Okay, so this virus, basically, the way it transmits by respiratory droplets. So when you cough or you sneeze, the transmission can take place with close proximity, especially, and from touching infected surfaces and touching your face. The virus roughly lasts about 14 days. This incubation period is 14 days, really. What it means, basically, from the time you're exposed and the time you develop symptoms can take up to 14 days. The symptoms basically will be similar to cold, really. But the main symptom which you can experience will be dry cough, high fever, usually more than 38 degrees Celsius, difficulty with breathing. But you can have symptoms, very mild symptoms like a cold, runny nose, sore throat, sneezings. But what is more important to know really is the atypical symptoms of this coronavirus. And that these are basically means it doesn't indicate you have it, but there is a possibility. So like headache, confusions, like having body aches, general muscle pains, loss of sense of smells or taste, or you can have diarrhea, vomiting. So depending on which part of your body it affects, you will have different symptoms. So you just need to be aware of it and look out for it.
Okay, and so these are the symptoms. Thank you so much for explaining that. And what are this? At what point should a person seek medical assistance?
So normally, when you feel like you have COVID-19, the symptom could be very mild, especially if you're very young and healthy. And that basically means you just need to self-isolate yourself and don't require to seek attention or see someone about it. But what you can is you can contact either or go to your family doctors, but you can contact them. If for any reason you're not able to contact them, you can call us. We do virtual care at the moment. So you can call us at 289-304-4666, and we'll be able to advise you what to do. The only time you need to worry about going, for instance, to calling an ambulance, and obviously you need to let them know the fact that you think you have COVID-19, so they take precautions, is when you have difficulty with your breathing and having issue with able to actually sustain having a good breath.
Okay, that's perfect. And what are the safety measures that one can take, especially, for example, I'm a mom of 2 young kids. When I'm going grocery shopping, I'm always anxious. Am I touching some, because even in grocery stores now, there's huge lineups to get inside the stores. Sometimes you don't know if the shopping carts have been sanitized or they haven't been sanitized. So what are the safety measures that one has to take to protect themselves and their families?
Yeah, so unfortunately, yes, we have to go to the shoppings, we have to do some things, but what we can do is to minimize the contact. So if you have to go to shoppings, try to reduce it to maybe once a week, once every 2 weeks, once every 4 weeks, as much as is possible. But in order to ensure that you are not containing the contracting these infections and also preventing the transmission, is simple measures really. Washing your hands frequently with soap and water. Obviously, you need to be careful, make sure you do moisturizing, because this frequency of using sanitizers or washing hands can cause problem with the skins of the hands. So that's going to give you other health problem. So it's very important after you are using sanitizers and washing your hands is to do moisturizing as well. Sanitizations of surfaces as well as groceries or packages. Keeping your distances of 2 meters, social distancing, which is very, very important. Because the viruses, when you cough or sneeze, so someone who has it, when they actually cough and sneeze, the droplets, respiratory droplets will fall, but they will not go too far. So that 2 meters of the distance, which recommended, is what will prevent you catching it. So when you go shopping, make sure you have that 2 meter of distance for sure, and obviously don't touch your face as much as possible. If you're having mask at home, or if you don't have mask, any kind of fabric which you have, use it so you can cover as at least the droplets, which will, when you cough or sneeze, will not cause someone else's to catch the infections.
Okay, and regarding masks, I know there's a few types of masks, especially the N95 that everybody was there's everybody wanted, and there's a huge shortage of masks. Is it safe to reuse a mask, and what types of masks do you recommend for someone that is just going out to do some basic grocery shopping?
Okay, I mean there are definitely different type of masks. I have some samples here. This one, which is a surgical mask, which most of the time what we use. As you can see, this here is where the wire is, and that is where it goes on the upside. Obviously, what you want to do is, so that's one mask, which I have which is called surgical mask. The other one, which is called respiratory mask, these are more for professionals. Obviously, there are different type of respiratory mask. The one which I have here is P95, which has got filtrations, and N95 is usually what healthcare providers use as well. And as I'm sure you know, there are a shortage of these. So these are the two type of masks which I have, and obviously, if you don't have any mask, you can always use any kind of fabric which you can make for at home and just cover your mouth. Basically, the idea of this mask is to prevent the droplet. When you cough or you sneeze, the respiratory droplets will actually stays there, and it's not going to be causing transmission to surfaces or other people. And using of the mask is very important. Is obviously you don't want to do this on your chin, so which is some people will actually do that. So what you want to do, you want to put on the mask straight onto your face, not touching the mask itself, and just the slings on the side. You press on here just to tie it up, as well as pull down here to seal it. So that's how you hold on to the mask. And obviously taking it off as well, just simply take it off like this. So you do not touch. If you do touch the mask itself, make sure you wash your hands with soap and water, which is very, very effective in making sure that you're not getting the infection yourself.
And is it safe for people to reuse masks and gloves when they have used it in the past, or?
Well, unfortunately, because of the shortage which there are, in an ideal world, yes, you don't want to reuse this mask because these are one-use masks. But because of the fact that there are shortage of masks at the moment, and we are struggling to obtain it, so yes, you can reuse them. Obviously, their effectiveness may drop, but it's better than having nothing. And as I said, even if you don't have any mask, which you can't find any mask at the moment, is just simple fabric to cover your face and your nose and your mouth is more than enough to protect you when you're going outside. You should really wear the mask, especially in a confined space. because of the fact that there are studies showing, especially in South Korea, that there is higher chances of the virus transmissions in a confined space if people do not have masks.
Okay, and there are a lot of myths around COVID-19. For example, there was a video shared a while ago that if you drink certain tea, then it reduces the risks of getting the COVID-19. Can you explain that? Can you explain the myth around about COVID-19?
Yeah, so unfortunately there are some. I had one patient today is asking me, is it okay to have milk, for instance? And
Yeah.
as far as I am aware, and there's no studies to suggest milk is harmful or to you. It's more helpful and protective of you, actually, rather than being causing you any problem. So there is no relationship between you having milk or teas or COVID-19. So yeah, there are quite a few, actually, quite high profile, which everybody knows about, is what Mr. Trump says about injecting as a disinfectant inside you. Of course, you should not be doing any such nonsense. It will cause you more harm than anything else. So some of the other myth which people may believe is that if I expose myself to the sun, will that protect me against the COVID-19, prevent me to get COVID-19? No, it doesn't. You can catch COVID-19 no matter how sunny outside is. Okay. If some people think if I have COVID-19, will I have it for life? No, most people who get COVID-19 will recover from it, will get rid of the virus from their system. As I said, one of the symptoms of COVID-19 is that you can have severe respiratory disorders. So some people think that if I be able to hold my breath for 10 seconds and have no difficulty with coughing or breathing, then I'm free of COVID-19. No, that's not true. So one of the things which people may think that if I'm in a hot environment, will I get the virus? Yes, you can. The body temperature is 36.5 and 37, and that's the ideal environment for the virus to actually live. So regardless of what's the temperature outside, whether it's hot or whether it's cold. Can I use hand dryer, for instance? That's one of the other things which people may think. Using hand dryers, will that kill virus? No, it doesn't. UV light lamp, can I use that to kill the virus? No, it doesn't. It actually can harm your skins more than it will help you with the virus. Another thing which some people may think that if I spray all of my body with alcohol or chlorine, will that kill the virus? It doesn't. Okay. So these are not the stuff which you should be doing. One of the vaccines which we normally use for pneumonia is called pneumovax, especially or pneumococcal. This is especially used for patients more than 50 years of age. So you having these vaccines doesn't prevent you from COVID-19. Unfortunately, COVID-19 is a new virus, and it requires its own vaccination to prevent against pneumonia, which the COVID-19 does. But so this vaccine, pneumococcal vaccinations, which we currently have, they don't. But it does prevent you against other respiratory illness. So it's still, you should be having it. I'm not saying that you should not have it. You should be having it, but it does not protect against the pneumonia from COVID-19. So one of the other myths is that I'm young and healthy and I'm not going to get COVID-19.
I have been hearing about that a lot, that I'm young, I'm healthy, I don't have any other health issues, my health is not compromised in any way, so I should be okay. But, we all fear that, it's like COVID-19, it's just another virus. So we have to be more, yes, we have to be more careful. Regardless, I could be healthy, and if I have the virus, I could be healthy, and I might have very, very mild symptoms, but I could be spreading it to, for example, my parents, God forbid, who are a lot older, and they might have some health issues, or their health might be compromised in a way that they don't even know it.
Yeah, that's right. It's basically it affects of all age. It doesn't differentiate whether you're young or healthy or old. Yes, elderly populations and people who has chronic conditions, they are higher risk group. But that doesn't mean necessarily that because you're young and healthy, you will not get it. And you rightly says that even if you're young and healthy, you'll be able to fight it, but you will pass it on to your family members who are elderly. So you should take the precautions no matter what is your age, and to make sure that you're not transmitting and not causing and adding to the pandemic.
Initially, when this whole COVID-19 it was new in early March, they were saying that kids they don't get coronavirus. Is that true?
No, unfortunately, it's not. As I said, all ages can be affected, and there have been cases of young as 1 year, 2 years who actually has got it, and unfortunately, some of them, as I don't think they've been healthy, but they have succumbed to the illness. So,
Okay.
any age group can be affected, and as I say, the higher risk group are elderly and people who's got chronic conditions, no matter what their age is.
Okay, so if somebody feels that they have the symptoms, and can they just call their family doctor, and can the family doctors do the testing for them?
I mean, they definitely can call their family doctors, but no, as a family doctors, we do not do the testing. There are specific place or centers which are called assessment centers where they will do the testing. They can either go online to do a self-assessment themselves. There's asking a few sets of questions and will advise them what to do. Or alternatively, they can call directly the telehealth medicine at 1-866-797-0000. So they can book them appointments at this assessment center after they've taken history for them to do a swabbing. There are some places which they do what we call drive-through testing. And that means basically you can drive in there, they will take the swab, send you home, tell you to self-isolate for 14 days, and they will call you if the test results is positive, or you can go online and check it yourself. Not all center does that. If you go and walk into a assessment center, they will not do that. Only certain places does that. So you just need to find out the nearest place where they do the assessment. So for instance, the William Osler hospitals, they have an assessment center where they do drive-through testing, or Orangeville Assessment Center is another.
Okay, and can you also talk about the importance of self-isolation? Because I know as Afghans, Mama Khuda, we all have family, and we all, whenever we have days off from work, we all want to be with our families. And I see a lot of especially through social media, everyone, some people, they're posting catching up with family, spending quality time with family. What is your opinion, and what's your advice to I'm not just saying Afghans are like that. There's a good population that is doing that, but what is your advice to them?
Yeah, I mean, Asian countries especially, I mean, Italy is one of the well-known places where people are similar to what people like Asian, where group of family lives together. So this normal ethics, social etiquettes which we have among ourselves, especially Afghans, Iranians, or any other Asian countries, where you hug, you kiss, you share, you gather together, live together. So this is what we call the highest risk area or environment, where one person, if they catch COVID-19, so the virus, the whole family can be getting it. And obviously, if they do get it, the whole family, they're going to go outside, they do shoppings, they also meet other friends, and in that way, they contributing to this pandemic and to the spread and transmission of it. So the normal social etiquettes which we have at the moment, we need to suspend it. We not need to do that in order to ensure our own safety, as well as the safety of our parents and grandparents and our children and the local and the community and the world as a general. So definitely we need to stop doing what we normally do in terms of socialization. And if you do have symptoms, it doesn't matter if your symptom, if you don't think you have COVID-19, even if it's a symptoms of cold, you need to self-isolate yourself. You need to stay inside your room and keep away from the rest of your family members to reduce their risk of getting the infections. And even inside your rooms, make sure you wear masks, because that, as I said, in a confined environment, the risk of transmission is a lot higher. So wearing masks will protect the rest of the family.
That's amazing.
So it's very important.
Thank you so much for all those great advice, Dr. Paywandi, and we're very grateful that you joined us and you're giving all this valuable advice to everyone. This is a very, very serious virus. I mean, it put all of our lives, like it just put everybody on a pause, you know, like a month ago or 2 months ago, we were all living a normal life. You know, everyone was busy with their own, you know, going to work, socializing and all that. And then in a matter of weeks, everything was completely shut down. So that's that should show the seriousness of this virus, and how I think what's different about coronavirus is the fact that the spread, that it's easily spread, you know, and I think it's one person can pass it on to up to 15 people. Is that true, Dr. Paywandi?
I mean, it depends on your social environment. Yes. I mean, as I said, most families, they will have about 5 to 7 people who lives there. So, and each of those persons will have friends. So it can easily spread very, very easily. And the other thing which I would like to also mention is for those who are sick, they should not be fasting. Okay. Because
that was actually going to be my next question. You know, it's Ramadan.
Good.
Ramadan, and we all have, you know, we all wait for Ramadan to come around, and it's the blessed month, Nam Khuda. But what's your advice, like on people that feel sick or they think, you know, should they fast? Should they not fast? What are the consequences of fasting and not fasting?
So basically, there are studies which is showing that if you are fasting, if you are sick and you are fasting, you have a virus, the more likely you will actually, your bodies will not be able to fight that infections, and more likely that will allow you to become sicker. And I was reading some studies specifically which affects the cells which fight infections, and those are mainly white blood cells in the body. So it may actually exacerbate your illness rather than helping you to improve. But if you're not sick and you are fasting, it actually is beneficial to your immune system. The study shows that the cells, like white blood cells, they actually do lower down, but they actually get recharged. And when your body fighting infections, it can get rid of infections a lot faster and quicker than when you're actually, if you're not, has not been fasting. There's a lot of study has been done on intermittent fasting and effects on the immune system. So if you fast, it actually helps you with your immune system. But if you're sick and you fast, it makes your situation worse.
Okay, I'm going to explain that in Farsi as well. We have a few people that have said, can you explain that in Farsi? So کسایی که در خصوصا در ماه رمضان روزه میخواین بگیرن، یک ماه مبارک رمضان است، اما کسایی که صحت کامل دارن اونا میتونن روزه بگیرن و روزه گرفتن برای خود بادی آدم بسیار beneficial، بسیار فایده‌مند است. اما کسایی که مریض هستن و اونا روزه میگیرن، اونا خود وجودشون بسیار ضعیف میشه و توانایی جنگیدن با می ویروس اونا بادیتان نمیداشته باشه. اگر خدای نخواسته ناجور هستین، میتونین که شما روزهتان نگیرین و بعد از رمضان بخیر یا بعد از اینکه ویروس کمه slow down شد، شما میتونین روزهتان به قضاییش بگیرین.
Or as per Islamic rulings, that if you are not fasting, you're supposed to donate charity towards poor peoples, and this will be the perfect times to help and support people in Afghanistan through you guys, CWB, to donate if they are not able to fast. So that will be one way of helping our country.
Exactly. Just like Dr. Saad said, so, if you can't fast, you can donate your
Kafara.
yes, to the people that are actually in need of your donation right now. Dr. Saab, I'm gonna ask you a question that the COVID-19, it had a very, a very, it was a very challenging virus for everybody. It affected everybody, whether it was poor or wealthy, regardless of financial status, it affected everybody. But what do you think, what are the challenges of people, especially the poor people that are living in Afghanistan? What are the challenges that they will be facing?
The challenge is unfortunately huge and quite dire in Afghanistan. IMF, even prior to COVID-19's pandemic, was concerned about the economic growth and slowing down of the economy in Afghanistan. And they were saying about 17% of revenue dropped in custom only. So due to ongoing conflicts, political instability, and obviously war, which has been going on for years and years, and the economy is not growing, and it goes towards negativity more than improving. So which results in having lack of funding, and obviously not having any fundings means that basic infrastructures in the country, which includes the healthcare system, will be inadequate. So our healthcare system may not be fully equipped to deal with a pandemic like COVID-19. So availability of testing, for instance, may not be there. The fact that the medical supplies like masks, like hand sanitizers, is not going to be there. And most people, unfortunately, in Afghanistan are living on day-to-day income. So their level of incomes is so low that they have to work every single day in order for them to actually be able to have a food on their table to eat. So the level of poverty is so high. And on top of that, once the social awareness of these preventive measures is not going to be much, which put the risk of the spread of COVID-19 very, very high in Afghanistan, unfortunately. So if someone cannot go to work, they stays at home, they can't work, obviously they're not going to have food. So they have to make this choice as what to do. They're going to go to work because of, and obviously that puts the risk of this infection high. And based on the map I've seen from Tolo media, it looks like most of the city has been affected by COVID-19, unfortunately, and mainly the one on the cities on the border, like Kabul, like Herat, are more affected because people has been coming, but the community spread is also there. So one way which we can help and making sure that this pandemic, especially in Afghanistan, is becoming less and is causing less risk of health to the population, is by helping those poor people so they can actually stay at home. And how you can do that? You across the world, whether it's Canada, whether it's USA, UK, Australia, any part of the world you are, you don't have to be Afghan. You can be anybody, non-Afghans as well. You're more than welcome in any way you can to help by donating. If you want to do it yourself personally, you can. If you want to go through any other charity organization, you can. If you want to go through the CWBC, Nuria Johns and Farid John is there to help. I know them personally. From day ones, I know when they build up these charities, I know they have no overheads. I know they do not take any salaries, unlike a lot of other charities, which obviously one of the reasons it puts people off to give to the charity. So this is your chance. And this holy month of Ramazans, you can help. Even if it's $1, $5, whatever it is, you can help by donating. Your $1 will be saving a life back in Afghanistan. Okay, so as much as you can, please donate and let's help and support our families, our friends, our countrymen in Afghanistan. You can join me. I'm gonna start pledging $1,000 right now to donation to the CWBC. So come and join me in supporting CWBC, CWB to help our countrymen or Afghans back home and let them stay indoors so they are able to fight this COVID-19 infection.
Dr. Saab, thank you so much, first of all, for your donation. That was very, you just made our day. As I mentioned in the very beginning of our live, Fadi John, he's a highly reputable lawyer in Toronto. I've been working at a law firm, for the past 12 years. And for both of us, there's no need to, to open an organization to benefit ourselves financially. And the team that we have built, everybody, Noma Khuda, is doing really, really well. So our main focus is just helping people back home. We just wanted to be a bridge between you and the people, the poverty-stricken families. And Noma Khuda, we have built that bridge, and it's a solid bridge.
Yeah.
It's a very solid bridge. Dr. Paywandi has been with us since we launched CWB. It was in 2016. He has donated to every campaign, every events that we have done in Toronto, not just you, your entire family, Dawood John, Ali John, you guys have always been great supporters of CWB, and we appreciate that.
Well, thank you, and thank you for your hard work, as well as the whole team in CWB. So you are doing a great job, and I'm sure God will reward you all very, very generously.
Thank you. And even today, I was listening on Tolo News that two young boys who were the sole breadwinners of their households, they used to polish shoes or sell bolanis during the day because his parents the mom didn't work, was a caregiver to their dad, and the dad had a back injury, so he could not work and he was unemployable. These two boys, they would work outside the house for 10-12 hours a day, and just yesterday, they lived in Pulkhumri, Afghanistan. Just yesterday, both of them, they died because of starvation, because they didn't have food. They hadn't ate for days. This is a reality, and the number of deaths will increase if we don't help people that that need our help. There are a lot of people that a few days ago, just a day before Ramadan, we had our distribution in Kabul set, and our volunteer called us and he said everywhere the city is on a complete lockdown. So he video called me and Ali Najan, and we were on the phone with him, and he showed us all the businesses were closed, all the stores were closed, except the people that the beggars, Gadaigara, were still there. People that were looking for even like a yag luqman on a khushk, they were still on the street. People who were, disabled, they were still on the street looking for a source of income or a source of food supply to take it to their families. So even on a lockdown means nothing for the poor family. It only means that it will increase their misery, it will increase their pain and suffering, because when coronavirus was just starting and everybody was panicking, we were all heading towards grocery stores, stocking up, and we all stocked up for at least 2-3 months. But these people, they don't have food for their next meal, and this is the time that for all of us to help. And Dr. Paywandi started a pledge, and we're very happy and appreciative of his generous donation. And so far, we have distributed in more than 11 provinces, and some are very remote areas. For example, Paktia, Faryab, Talaqan. These are the remote areas, but we have still managed to supply food packages to families that were either street workers or beggars or widows, orphans. They're the most deserving and most vulnerable families that we could find them, and we deliver them. The packages will last them for at least a month and a half to 2 months, and so that means that they will be safe. If they have enough food in their household, they will stay at home. They will be safe. Their families will be safe. Afghanistan will be safe. But if they don't have meal, if they don't have food, nobody's going to be safe. They're all going to be outside. They will not they will not obey the lockdown. They will not obey the and they're helpless. Like if I see my child crying or going to bed hungry, I'll be on the street. I'll be begging. I'll be doing anything to make sure that my kid doesn't go hungry the next day. So please be sure to donate generously, and just like you have. And thank you for everybody that has donated so far, and that continues to donate. Our campaign has been doing really, really well. And back to Dr. Paywandi for your great advice and tips. And do you have...
My pleasure. Thank you so much for you and all of the members in CWB of hard work and doing their best in order to make the situation better in Afghanistan. So please, all of you, please come and join us and in supporting our people back home by doing donations. And you can pay any amount. It doesn't matter how much you can afford. Try to do your best and try to take the reward of this holy month of Ramazans and pay your dues by donating to CWB or any organization you feel comfortable doing it. And as I said, these people are doing this out of their goodwill, and they are not taking any salaries. So 100% of the money from your part, which you pay, goes to the people who are in need. No salaries, no overheads, no other expenditures.
Thank you, Dr. Sabana. Before we end this live session, I just wanted to thank Lamia Afghan Foundation. They're a registered charity based in states that have collaborated with us in this campaign. And actually, this organization is founded by a general that served time in Afghanistan. And when he came back to the States, he wanted to continue his contribution. Both him and his wife, John and Jan Bradley, they wanted to continue their assistance and their contribution to Afghanistan, and they have done amazing work in Afghanistan, and we're happy to have them as our partner in this project, as well as all of our team members, especially our ground personnel in Afghanistan, that they're risking their life to make sure that your donation, your zakat, and your fitr roza gets to the most vulnerable families. So thank you, and once again, thank you, Dr. Paywandi, and have a great and blessed Ramazan Bakhir. I'm sure we'll be bringing you or requesting you to come live again. We had a great session, and you gave all of our viewers beneficial tips, and we'll hopefully we'll have you back in our
Thank you so much. Thank you so much for the invites, and all the best. Yeah, inshallah, we'll talk again.
Thank you. Khuda Hafiz.
Khuda Hafiz. Bye bye.